Oral immunotherapy for treatment of egg allergy in children. The purpose of the study is to determine that oral immunotherapy to egg is safe and effective to desensitize patients and induce substance unresponsiveness. The study population was a double-blind randomized placebo-controlled study of 55 children from 5 to 11 years of age, sensitive to egg, with 40 receiving OIT and 15 placebo.
Shock, or hypoperfusion, is the inability of the circulatory system to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time.
Method: initial dose escalation and build-up maintenance phases of 2 grams of egg protein. This was followed by an oral food challenge with egg white powder and 10 months and 22 months. Children who successfully passed the challenge at 22 months continue OIT and avoid egg consumption for 5 to 6 weeks. At 24 months, these children had oral food challenge in egg powder and cooked egg to test for unresponsiveness.
Topic is H-Y-P-O, bulimia. And this condition relates to the absence of adequate fluids in the body. So you get a whole different picture of the patient here. The patient tends to be quite drawn, thin from their normal appearance. And their overall cognitive perceptual status involves a lot of and in terms of their heart.
The result of the study was, after 10 months of therapy, none of the children who received placebo and 55% of those who received OIT passed an oral food challenge of up to 5 grams of egg protein and were considered desensitized. At 22 months, 75% of children in the OIT group were desensitized and tolerate up to 10 grams of egg protein. In the OIT group, 28 passed the oral food challenge at 24 months and were considered to have sustained unresponsiveness. At 30 to 36 months, all children who had passed the oral food challenge at 24 months were consuming eggs without restrictions. Conclusions. This study shows that OIT can desensitize a high proportion of children with egg allergy and induce sustained unresponsiveness.
Alright guys, so let's get into our hypovolemic shock. And really, hypovolemic shock is really just the same thing as cardiogenic shock, almost, just on a different level. We're still decreasing pressure, which is decreasing our perfusion, but when we're we're decreasing pressure, we're talking about all of the hemoglobin in the blood, the oxygen transports in the blood, not being there anymore. We're decreasing that so we don't have enough perfusion around the body. So we're going to have pretty much the same clinical manifestations as cardiogenic shock, just a decrease in oxygenation. So let's get into it again. Okay. So
well, welcome to another lecture. We're going to talk about the treatment for shock. Please refer to the lecture called Shock Explained Clearly for the background on that information. But what I'd like to get into is the treatment for the different types of shock. Okay, the three different types of shock we're going to talk about is number 1, hypovolemic. Number 2 is cardiogenic. And number 3 is septic. And you will remember that we talked about the different pathophysiology of these shock syndromes. Hypovolemic starts off with a low amount of volume in the body from either bleeding or dehydration or blood loss, and that can cause a low JVP, which will cause a low cardiac output and a high systemic vascular resistance.
Thanks.